Question 1. A nurse is caring for an elderly patient with protein-calorie malnutrition. Which finding should the nurse prioritize for immediate intervention? A. Hair thinning and brittle nails. B. Hemoglobin level of 7.8 g/dl. C. BMI of 17.5. D. Complaints of fatigue. Answer. B. Hemoglobin level of 7.8 g/dl. Question 2. Which task related to nutritional support for a malnourished client can be safely delegated to the nursing assistant? A. Assessing the patient's caloric intake. B. Monitoring for signs of aspiration during meals. C. Assisting the patient with feeding. D. Initiating enteral feeding via NG tube. Answer. C. Assisting the patient with feeding. Question 3. A patient with severe malnutrition is prescribed TPN. What is the nurse's priority action? A. Check blood glucose levels regularly. B. Monitor for signs of dehydration. C. Flush the line with saline every 8 hours. D. Administer multivitamins orally. Answer. A. Check blood glucose levels regularly. Question 4. Which patient should the nurse assess first? A. A patient with mild anemia and weight loss. B. A patient with marasmus who is lethargic. C. A patient reporting occasional nausea. D. A patient with a pressure ulcer stage I. Answer. B. A patient with marasmus who is lethargic. Question 5. A malnourished patient is receiving refeeding. Which electrolyte abnormality requires immediate attention? A. Hypocalcemia. B. Hypokalemia. C. Hypophosphatemia. D. Hypernatremia. Answer. C. Hypophosphatemia. Question 6. Which action should the nurse take to ensure safe delivery of enteral feeding? A. Administer feeding with patient in a supine position. B. Verify tube placement with air insufflation. C. Elevate head of bed 30 to 45 degrees. D. Warm feeding to body temperature. Answer. C. Elevate head of bed 30 to 45 degrees. Question 7. A nurse is preparing to discharge a malnourished patient. What is the most appropriate community resource to refer? A. Alcoholics Anonymous. B. Meals on Wheels. C. Red Cross Shelter. D. Crisis Hotline. Answer. B. Meals on Wheels. Question 8. The nurse notes that a malnourished patient is refusing food due to loss of appetite. What is the best nursing intervention? A. Force feeding to meet caloric needs. B. Ask provider to insert NG tube. C. Offer small, frequent meals. D. Provide 4 fluids. Answer. C. Offer small, frequent meals. Question 9. A nurse is caring for a patient with kwashiorkor. Which intervention is a priority? A. Offer high-fat snacks. B. Provide high-protein supplements. C. Monitor sodium intake. D. Limit oral fluids. Answer. B. Provide high-protein supplements. Question 10. A nursing assistant reports that a malnourished patient is coughing during meals. What should the nurse do first? A. Suction the airway immediately. B. Reassess swallowing ability. C. Request a chest X-ray. D. Change the patient's diet to clear liquids. Answer. B. Reassess swallowing ability. Question 11. What teaching should be emphasized for a client with chronic malnutrition and a new prescription for oral iron? A. Take iron with milk. B. Take iron with vitamin C-rich foods. C. Take iron at bedtime. D. Avoid taking iron with food. Answer. B. Take iron with vitamin C-rich foods. Question 12. A nurse caring for a child with signs of marasmus should anticipate which of the following interventions? A. Increase protein and caloric intake slowly. B. Begin 4-dextrose infusion immediately. C. Initiate corticosteroid therapy. D. Restrict fluids to prevent overload. Answer: A. Increase protein and caloric intake slowly. Question 13. A nurse is teaching a UAP assisting a malnourished patient. Which instruction is most important? A. Help the patient walk after meals. B. Do not force the patient to finish meals. C. Record intake and output accurately. D. Encourage the patient to drink more coffee. Answer: C. Record intake and output accurately. Question 14. Which statement by the patient with malnutrition indicates a need for further teaching? A. I should eat more eggs and meat for protein. B. I'll drink a protein shake with my meals. C. I'll weigh myself once a month. D. I will avoid skipping meals. Answer: C. I'll weigh myself once a month. Question 15. Which is the most appropriate nursing diagnosis for a patient with severe malnutrition? A. Risk for deficient fluid volume. B. Risk for infection. C. Imbalanced nutrition, less than body requirements. D. Risk for falls. Answer: C. Imbalanced nutrition, less than body requirements. Question 16. Which nursing action reflects an interdisciplinary approach to malnutrition? A. Administering prescribed supplements. B. Documenting daily weight. C. Collaborating with a dietitian. D. Monitoring intake and output. Answer: C. Collaborating with a dietitian. Question 17. Which patient is at highest risk for protein-energy malnutrition? A. A pregnant woman in her third trimester. B. A preschooler attending daycare. C. An older adult living alone with poor dentition. D. A teenager who skips breakfast. Answer: C. An older adult living alone with poor dentition. Question 18. A nurse reviews a malnourished patient's chart and notes a serum albumin level of 2.1 g/dl. What complication is the patient most at risk for? A. Dehydration. B. Ascites and edema. C. Hypernatremia. D. Hypertension. Answer: B. Ascites and edema. Question 19. A patient is admitted with severe malnutrition and confusion. Which lab value requires immediate intervention? A. Hemoglobin 11.5 g/dl. B. Blood glucose 120 mg per deciliter. C. Sodium 110 milliequivalent/L. D. Potassium 4.2 milliequivalent/L. Answer: C. Sodium 110 milliequivalent/L. Question 20. What is the most effective strategy for monitoring the nutritional status of a long-term care resident? A. Monthly weight check. B. Recording daily fluid intake. C. Tracking weekly weight and intake trends. D. Asking about hunger levels. Answer: C. Tracking weekly weight and intake trends. Question 21. A patient with severe malnutrition has developed a pressure ulcer. What is the most important nutrient to promote wound healing? A. Vitamin A. B. Vitamin K. C. Protein. D. Potassium. Answer: C. Protein. Question 22. During morning rounds, which malnourished patient should the nurse assess first? A. A patient with low appetite and mild weight loss. B. A patient with a serum potassium of 2.9 milliequivalent/L. C. A patient requesting to see a dietitian. D. A patient who is refusing oral supplements. Answer: B. A patient with a serum potassium of 2.9 milliequivalent/L. Question 23. A nurse notes a malnourished patient is experiencing confusion and tremors. What lab value is the priority to assess? A. Magnesium. B. Calcium. C. Hemoglobin. D. White blood cells. Answer: A. Magnesium. Question 24. Which intervention can the nurse delegate to the nursing assistant when caring for a malnourished patient? A. Documenting food allergies. B. Weighing the patient daily. C. Assessing muscle wasting. D. Teaching about oral supplements. Answer: B. Weighing the patient daily. Question 25. A nurse suspects a child is experiencing failure to thrive due to malnutrition. What should be the nurse's first action? A. Notify social services. B. Ask about home feeding practices. C. Request a pediatric nutrition consult. D. Document the child's BMI. Answer: B. Ask about home feeding practices. Question 26. The nurse is caring for a patient on a vegan diet who is experiencing fatigue and tingling. Which deficiency is most likely? A. Vitamin B12. B. Calcium. C. Vitamin A. D. Iron. Answer: A. Vitamin B12. Question 27. Which statement indicates that an elderly patient understands how to prevent malnutrition at home? A. I drink soda to stimulate my appetite. B. I avoid snacking between meals. C. I eat small meals with protein and calories. D. I skip meals when I feel tired. Answer: C. I eat small meals with protein and calories. Question 28. The nurse identifies a serum prealbumin level of 9 milligrams per deciliter in a malnourished patient. What does this indicate? A. Adequate protein intake. B. Mild fluid overload. C. Acute protein deficiency. D. Dehydration. Answer: C. Acute protein deficiency. Question 29. A patient is admitted for alcoholism and shows signs of malnutrition. Which vitamin deficiency should the nurse be most concerned about? A. Vitamin C. B. Thiamine, vitamin B1. C. Vitamin K. D. Vitamin D. Answer: B. Thiamine, vitamin B1. Question 30. A malnourished patient has a new prescription for migestrol. What should the nurse monitor for? A. Signs of infection. B. Increased appetite and weight gain. C. Decreased bowel movements. D. Elevated blood pressure. Answer: B. Increased appetite and weight gain. Question 31. Which malnourished patient is at highest risk for aspiration? A. A patient with dementia who eats unassisted. B. A patient receiving 4 fluids only. C. A patient with lactose intolerance. D. A patient with a BMI of 16. Answer: A. A patient with dementia who eats unassisted. Question 32. A nurse is educating a family on improving the nutritional status of a child with malnutrition. What should be emphasized? A. High-fat, low-protein snacks. B. Balanced meals with essential nutrients. C. Encouraging the child to skip breakfast. D. Avoiding all carbohydrates. Answer: B. Balanced meals with essential nutrients. Question 33. A malnourished patient's potassium level drops to 2.5 milliequivalent/L after beginning nutritional therapy. What is the nurse's priority action? A. Notify the healthcare provider. B. Encourage more food intake. C. Continue current treatment plan. D. Restrict fluid intake. Answer: A. Notify the healthcare provider. Question 34. Which assessment finding in a malnourished elderly patient requires immediate intervention? A. Sunken eyes and dry mouth. B. Unintentional 5% weight loss in 1 month. C. Dry skin and brittle nails. D. Mild pitting edema in the ankles. Answer: A. Sunken eyes and dry mouth. Question 35. A nurse finds a malnourished patient with low serum albumin. What nursing diagnosis is most appropriate? A. Ineffective airway clearance. B. Impaired tissue integrity. C. Risk for injury. D. Disturbed sleep pattern. Answer: B. Impaired tissue integrity. Question 36. A patient on long-term tube feeding has a distended abdomen and vomiting. What is the best nursing action? A. Stop the feeding immediately. B. Administer an antiemetic. C. Lower the feeding rate. D. Encourage ambulation. Answer: A. Stop the feeding immediately. Question 37. What is the nurse's priority when feeding a malnourished patient with severe dysphagia? A. Offer thin liquids. B. Provide frequent snacks. C. Maintain NPO status until swallow evaluation. D. Insert a nasogastric tube. Answer: C. Maintain NPO status until swallow evaluation. Question 38. A patient recovering from pancreatitis is at risk for malnutrition. Which diet order should the nurse question? A. Low-fat diet. B. High-protein soft diet. C. Clear liquids diet. D. High-fat diet. Answer: D. High-fat diet. Question 39. A patient with malnutrition and ascites is receiving albumin. What outcome indicates treatment effectiveness? A. Increased abdominal girth. B. Decreased edema. C. Decreased urine output. D. Decreased appetite. Answer: B. Decreased edema. Question 40. A malnourished cancer patient is refusing meals. What is the best nursing response? A. You must eat to stay strong. B. Can I bring you a preferred meal option? C. You'll need tube feeding soon. D. Let me call the doctor to stop your meals. Answer: B. Can I bring you a preferred meal option? If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.